The Center for Research on Violence Against Women at the University of Kentucky is the nation's only center focused solely on research to address and prevent gender-based violence.
We are the Center for Research on Violence Against Women. That distinguishes us as a group of endowed faculty who are trying to do the best quality research that we can to both ease the plight of victims of violence, but also we have as a very strong goal to come up with the kinds of research studies that we hope will help us and help other people aim toward preventing violence.
The problem of gender-based violence or violence against women is a global social problem and a global public health problem. But it's a problem that is surrounded by lots of myths and stereotypes and misinformation. A research center and research in general is really important because it separates fact from fiction. It provides us with empirical data on a problem, and you can't solve a problem unless you have accurate information about the causes of the problem, risk factors, unless you know about victims and perpetrators.
The data that we're collecting, it's not just data. It's people's behaviors, it's their experiences, and those data points have a voice. And so being able to provide a story to that voice is a really important part of what we're doing. The issue is that data is complicated and it's complex, just as complex as the questions we're trying to answer. And to try to do that as a single person and talk about that story is really difficult. It really requires a team with lots of different perspectives and research backgrounds.
When the center was established back in 2004, the early goal was to bring together a variety of professionals who actually could bring different types of expertise, different knowledge bases, who could all share their skills and produce the best possible research studies. In our center we have public health epidemiologists, we have a sociologist whose specialty is criminology, we have 2 psychologists, we also have a biostatistician.
You can have a room full of geniuses, and if they all look at the issue through the same lens, you're not going to be able to address the problem holistically. But if you have a lot of people who have done research on a problem, but from multiple perspectives, you're likely to be able to develop a multidimensional solution to that problem. And that's really what we do in the Center for Research on Violence Against Women. And we also partner with people in other departments who are not center faculty and with people outside the University of Kentucky. So it's really a center that goes beyond the walls of Bowman Hall and also goes beyond the boundaries of the university.
Ann Coker leads the research team evaluating the Green Dot Bystander program. A recent CDC-funded study in Kentucky high schools demonstrates the program reduces violence.
We actually teach people how to identify situations that might be risky and figure out how to safely but effectively intervene to reduce the risk of violence. If we can intervene to teach people how to take care of each other, that's really what we're talking about when we talk about bystander behaviors. Then you have the potential to see that carried out into adulthood. The Centers for Disease Control and Prevention provided us funding to evaluate the program as it was disseminated in 26 schools. So it's a randomized intervention design, which means that half the schools were randomized to get the intervention and half were not. And then we surveyed people in all 26 schools over a 5-year period.
So as Dr. Coker and I were talking about the data, she said, why don't you just come and see what it's like? So I went out to the high schools and collected the data, and that's really helpful because the study design informs analysis, but so does how the data is collected.
It really took about 2 to 3 years before we started to see a decline in violence rates. In the schools that got the intervention, we found lower rates of sexual violence perpetration in those schools relative to the schools that didn't have the intervention. And that was in the neighborhood of a 40 to 50% reduction. And that's a big impact.
To be able to see the reaction when you can tell people that the data that they've collected and the efforts that they've done, that's made a difference. It's made a difference in the research, and it has the potential to make a difference in students' lives. That's why the Green Dot Project is so exciting.
The University of Kentucky is leading the nation with data on sexual violence and campus safety, thanks to a groundbreaking survey that includes all UK students.
President Capilouto, who really cares about the issue of violence and safety on this campus, decided to sponsor an annual survey that he hoped would be able to get feedback from all UK students. We're talking about 27,000 students. And he came to us and asked us to develop, implement, and then to analyze a survey that would be done for the next 5 years. It's been quite a gargantuan task, developing what are the kinds of questions that would be best to ask to get the most relevant information about students' perceptions of safety, what is their knowledge of resources on campus, as well as the negative experiences that may have happened to them if you don't know what particular issues are for your campus. If you're not able to come up with ideas for ways to prevent it from happening, you're pretty much working in the dark.
Not only is it trying to assess the campus climate, it's really changing campus culture and having students from all levels take this assessment to tell us what's going on in their environment. What safety concerns do they have? What experiences do they have? And now we're at the point where we're trying to analyze the data so that we can create reports and get that information back to the students, to administrators, policymakers, as they make decisions to try to improve the safety of the campus. And one of the really exciting things about this project is that there are some pretty significant methodologies that we had to consider in creating the survey and disseminating the survey. And so we're at the point now where we can share that information with other colleges and universities. So the impact is significant. Not only can we change the safety and the environment of our own students, but we have the potential to really change multiple campuses.
Claire Renzetti and Diane Fallingstad are collecting data to determine whether being involved in a horticulture program at a battered women's shelter has therapeutic effects for women who have experienced abuse.
Greenhouse 17 is actually the name of our local battered women's shelter. The shelter is unique because it's located on 40 acres of farmland. Like a lot of nonprofits, they were facing increasing food bills and other budget constraints, and so the associate director, who is just a real idea person, she thought one of the ways that maybe they could reduce their food bills would be to go back to having it be a farm. What they did was they started a program where the women residents can volunteer to work outside, or they can sign up for a stipend program where they work for about 10 hours a week and get paid to do it, and they really work the farm. The staff at the shelter began to notice changes in the women who worked the farm over and above what they were seeing with women just participating in regular shelter programming. And so they were saying, you know, the women are having fewer drug and alcohol problems. They're seeing increases in self-esteem. So there were all these positive indicators, but there was no empirical evidence. So Diane Fallingstad and I are engaged in an evaluation of the farm program. We have the study planned for a 3-year period. We expect actually to have more than 300 women enrolled in the study over that period of time. So we're comparing the outcomes of the women who work the land with the outcomes of the women who do just the working with the farm products, with women who don't do any of those things. And what we want to see is if their outcomes are different. We're measuring the outcomes during their stay in the shelter, but then we're doing a 3-month follow-up after they leave the shelter to see if anything that happened affects them post-shelter stay. And we're hoping that the findings will produce data that the shelter can use to help them get additional funding.
With virtual reality, Charlie Carlson is evaluating whether training women in breathing techniques helps them to manage high-risk confrontations.
My research focuses on developing self-regulation strategies for people to use in high-risk situations. The example that we use in our virtual reality environment is you meet a young man at a party, and initially he seems like he's very nice. The weather changes and you need a ride home, so he offers to give you a ride home. the weather turns very, very bad, and so he has to stop, and then he turns very, very bad. And we want to evaluate how women manage that difficult situation. Our primary focus is to introduce them to a breathing strategy that they can learn, that we know from previous research helps keep them under physiologic control. So our goal in our initial study was to determine whether we could introduce these women to a strategy for them to control their breathing, and that would influence the outcomes from the virtual experience. People find this experience quite real, and it alters how they think and how they feel, as well as how their bodies are responding to this event. So we have found that this environment provides us with an excellent opportunity to explore how we can teach women to make good decisions in a very difficult situation.
Center faculty want to create an online course to train nurses to accurately identify domestic victims of sex trafficking.
Based on what we know from federal data, most trafficking victims in the United States are U.S. citizens, and their traffickers are U.S. citizens. Now, that's particularly true for sex trafficking victims, and about 90% of them are women. Women can be trafficked. Young girls can be trafficked from their own neighborhoods, from their own homes. It's really hard for people to identify victims if they don't know what they're looking for. But what some of the research has shown is that many sex trafficking victims feel that healthcare settings are fairly safe for them, in that they don't get asked a lot of questions. They have to go for healthcare, so they'll go to an ER or they'll go to a public clinic. They don't expect anyone to figure things out. And given that that is a likely place for professionals to encounter sex trafficking victims, we thought it would be good to train healthcare professionals in those settings in how to identify sex trafficking victims. They often don't go to these places alone. They're accompanied by someone who's keeping an eye on them. So the only opportunity that professional might have to talk with them is when they are actually in the examination room and they're alone. Diane Follingstead and I have developed a curriculum that's online to train healthcare professionals, particularly ER nurses and public clinic nurses, in how to identify potential trafficking victims, and then how to provide the victim with perhaps a palm card that tells them how they can get help.
With NIH funding, Ann Coker is looking for ways to identify cancer patients with histories of abuse to see whether partner violence negatively impacts their cancer treatment and recovery.
There are psychological abusive behaviors that can occur in people in vulnerable situations, here defined as people who may have cancer. And so what we wanted to do was to look at the effect of psychological abuse, physical abuse, sexual abuse that may occur either in the past or currently that may influence how well women do with cancer. And of course, the longer term would be to look at how do you screen for that? How can physicians screen for that or nurses screen for that? And then reduce the risk of that negative partner behavior affecting how women do. This state has one of the few statewide well-funded cancer registries. We use the cancer registry as a source of our patients, and that's not a common way to recruit individuals. So it was a great resource for us. We started looking at the screenable cancers, so that would be breast cancer, cervical cancer, and colorectal cancer. We then expanded it to a range of different cancers, so we included lung cancer as well, and found very similar patterns in those cancers, so that the type of cancer mattered less.
What science-based approaches enable us to do is to test and refine our theories and our practices in a systematic way. The ultimate goal is to provide women with the best of what we know that can serve to protect them from violence in their environments.
We look at the data and we look at it again and again. And when we do that, we can identify potential solutions. So we say, oh, this might work. Then we're going back to say, did it actually work? But is that searching and researching that gives us the real value of the center?
The hope is that by conducting research studies, where you can compare different kinds of interventions, or you can evaluate how effective some type of program is. You can put your resources into the most effective programs possible, and hopefully to even be able to come up with ideas for the best ways to prevent violence.
Giving us all a home where we can come together and work as partners on these problems makes a significant difference in the contributions we're able to make.